is a line to be crossed.
Okay, I think we'll get started, and Councilman Huber's on the phone? Okay.
Yes, I'm on the phone.
Okay, I now call the October 31st, 2020 special meeting to order, or emergency meeting to order. All council members are present. Any abstention or nay votes? All voting aye?
Aye.
Please record.
Aye.
Please record the vote.
All members present and Council Member Huber on the phone, we're set.
Okay. Council will now discuss a resolution for rescinding the temporary extension of hours of operation for liquor license holders and curtailing the time liquor license holders may remain open on Halloween. Because this is not on the consent agenda, it will be open for discussion by council. Please.
Should we have the Pledge of Allegiance? I know it's not in your script, but we normally open all meetings with the Pledge of Allegiance.
Well, we can, except for our work sessions, we don't, but we can on this. All right.
I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, with liberty and justice for all.
I don't even know what I am.
Thank you, Mr. Mayor.
Thank you. Please read the resolution by title only.
The resolution rescinding resolution number 2020-206, which allowed retail liquor license owners to remain open and extended hours on Halloween, October 31st, 2020, and the adoption of this resolution curtailing the time liquor license owners may remain open on Halloween.
Chair would entertain a motion to approve the resolution just read.
So moved. So moved.
Moved by Councilman Pacheco, second by Councilman Huber. Mr. City Attorney.
Thank you, Mayor. Thank you all for coming in today. Yesterday around 4 o'clock, my office received notice that there was a request for an emergency meeting or a special meeting to have this conference today to look at the former resolution 2206, which permitted extended hours for liquor license owners this night and tomorrow morning early. There were some concerns, and I think the mayor will address that, about the number of COVID cases, both within the community as well as the stresses on the hospital. As a result of that, we have drafted a proposed resolution for your consideration. I would note in that this is being called as an emergency meeting, and the reason for that is that it would seem to fall within the provision of the statute for that, and we wanted to be able to get this out in sufficient time so that liquor license owners would know what to do this evening, tomorrow morning, with their hours. So the emergency meeting provision is actually found in 16-4-404 in subparagraph D, which provides that the governing body of an agency may hold an emergency meeting on matters of serious immediate concerns to take temporary action without notice. Reasonable effort shall be made to offer public notice. And I would put into the record and for the minutes that reasonable efforts we believe were made, that email to the media was sent out with links to the web page. Emails were sent to the liquor license holders that had emails, and those liquor license holders without emails were actually received a call, I believe, from Fleur Tremmel, the clerk herself, to make sure that they were given some notice. So efforts were made to get the word out so that people could attend or contact their council members to discuss this if they so chose to do so. In looking at that, Mr. Mayor, I believe that should take care of the preliminary matters, and we would leave it, turn it over to you.
Okay, do we need to have somebody amend the statute in the resolution itself?
I think, yeah, if we could get someone to make a motion right off the bat before you discuss it, just to get an amendment. And it has been, it's on the table now, so if we could just get a motion to amend the reference in the third full paragraph of the resolution to go from 16.4.405D to 16.4.404D. That would be appreciated.
It's a typo, so if I can get somebody to, okay, motion moved by Councilman Hopkins,
Second.
second by Councilman Pacheco. All in, or any discussion on that?
What are we voting on right now?
Right now, what we're voting on is there's a typo in here, so we're just correcting the typo.
Okay.
So any discussion on that? Okay, all in favor say aye.
Aye.
All
Aye.
opposed say nay. Please record the vote.
Motion to amend passed.
Okay, so now we come back to the facts, correct, Mr. Henley?
Yes, sir.
Okay. So I've written a lot of notes down because there's quite a bit of stuff to this, but yesterday we had a meeting and it entailed Casper College, Natrona County School District, County Health, Wyoming Medical Center, Infectious Disease, County Commissioners, and then myself and City Manager. The report that was given to us was that well, first of all, if we back up, on the 20th, we initially came in front of council with the proposal to allow bars to stay open until 4 o'clock in the morning, and it was approved at that time. Where we were at then to where we're at today has changed significantly. The report that was given to us in the room yesterday was that the number of COVID cases in the community is rising at an alarming rate. In just the past 24 hours, we've received 60 new positive cases, and this is one of the slow days. Saturday, we don't get as much reporting that comes back then. We currently in the county have 434 active cases. The doctors yesterday asked us to rescind, do exactly what's being asked today because of the amount of cases that are taking place. And they fear that an evening like tonight with Halloween and the amount of people that are going to be in these in large gatherings, the numbers are going to spike. It appears that the people that are becoming infected in the community they're getting infected in the community and they're taken back to they're taking it back into the workplace. The hardest portion of our population being hit right now is in the assisted living facilities. Current numbers for 4 of these long-term or assisted living facilities are 120 positive residents and 80 positive staff. Out of these facilities, there have been 9 deaths in the last 15 days. 8 people are actively dying or will die very soon and have been placed into comfort care because there's nothing else they can do for them. They're going to die. Adding to this, a conversation has already taken place between the health officials and the county coroner's office over the rising number of deaths and the limited space that they have. Total deaths, so the 9 deaths that we talked about and the 8 pending deaths are coming out of assisted living facilities, but there's another additional 6 deaths that need to be added from the hospital that are coming from that. So we have right at 14 deaths in the last 2 weeks that have occurred in our community. And they have underlying conditions, most of them, but COVID has been one of the driving factors in these people dying. The other problem that we have is there's 250 healthcare workers in modified quarantine, which basically means their duties have been modified. Even though they're sick, they're able to do their job because of the staffing shortage. And we are right at 50 essential services employees, which means city operations, fire, police, refinery staff that are also on modified quarantine or isolation. As far as new positive cases coming in and doing contract, well, first of all, it's taken 28 to 48 hours in order to get any results back. And then as far as contract tracing to see who else possibly has it, the county health department has been using the assistance of the National Guard now to go and do this contract tracing, or contact tracing. The health officials have asked that we rescind the resolution order due to the amount of people in the establishments and the extended amount of time, as it's only going to increase the spread of the virus. Now, on the flip side of that, the person that petitioned us to stay open in the first place up till 4 o'clock in the morning, I had a conversation with him. And he brings up a very valid point that we're taking a precaution to rescind the orders, but then we're also asking them to back up 2 hours. And so his argument is, first of all, Halloween's Black Friday to the bars, and this is when they make up for the loss in revenue that they've already had. But if we close the bars at 2 o'clock, and other bars and other communities around us are not taking this stance, and they don't close until, or if we have them close at midnight and they don't close till 2 o'clock, now the amount of people in bars in Casper will go to outlying communities, and we're going to have larger gatherings within smaller bars and potentially spike the virus itself. So there's two sides to this, and completely get it. The health doctors and health officials are coming from the alarming rate of people that are dying and the amount of positive COVID tests that are taking place. So that's what brings us here today, is the question of the health department would like us to rescind it and back it up till midnight. Flip side of that is you have bar owners that are, obviously they don't, even if it was rescinded, moving it back 2 hours is a problem to them. Vice Mayor Lutz.
At the end of the day, I fully understand where the health doctors are coming from, and obviously I would defer to them because I'm not a doctor. I don't understand how medical things work. That's not what I do for a living. That's what they do for a living. But I think the argument could very easily be made that if somebody were already in one of these establishments, which they're likely going to be, I think it is very unrealistic to argue that, well, as long as they close at midnight, they somehow won't contract it or spread it. But if we let them stay there till 4, by golly, that's when it's going to happen. Like, and so I guess my point is, if there is that truly that high level of a concern, coming and asking us to move it back to midnight isn't going to be the fix. Coming and asking us to, I mean, and this is a health department call, not city council, but not even having establishments like that open is, to me, what they're trying to accomplish. That is the way to accomplish what it is. Cutting back the hours isn't going to accomplish that. If somebody is there at 4 a.m., chances are they very well were there at midnight. And like you said, if we close the bars at midnight, they're literally just going to go to a house party, or they're going to go to that Butch's place in Evansville or the Beacon in Mills, and the spread is still going to happen. It's also extremely unfair at 1:15 to let an establishment know that within no notice at all, especially I had received an email, Gaslight Social paid somebody like a DJ from California to fly out here for their Halloween party. So now, you know, they have all these expenses, they've done all this advertising, and we're giving them less than 12 hours notice that we're changing their hours of operation. And I don't think that it's accomplishing what the health doctors would like it to accomplish.
Councilman Bates.
I agree with Councilwoman Lutz. When we looked at this, the question was, you know, the person asked for it to be open until 4. And the reason was to spread out, where instead of everybody showing up from whatever time to just to 2 and pack the place, by extending the hours, it spreads it out a little bit more, so you don't have as many people in one establishment for length. Now, could it still happen? Yes. But the idea was to spread it out so more people have places to go and you don't have as big of a crowd. That was the whole reason. We all agreed that day, it was unanimous to allow it to be open until 4. And I would say we need to stick with what we decided on, and by spreading out, maybe more establishments choosing. If a place wants to close down at 12, that's their choice. If they want to listen to the health officials, they can close at 12. Any one of the places can. Those who want to stay open until 4, I think they have every right to stay open at 4 because we've already passed this. So that's my opinion.
Councilman Johnson.
And I agree with the last couple council members. And you've already got crowds of people out if you saw downtown. I mean, granted, that's outside, but there's a lot of people packed in Davis Street Station in very close quarters. And then we're going to have the event center open this evening. And I'm sure there's going to be quite a few people in that building as well. So to me, this is kind of a moot point, and it's really unfair to these businesses who plan for this, and now all of a sudden we're like, oh, just kidding. So I'm gonna vote nay.
Councilman Powell?
Thank you, Mr. Mayor. First off, I want to thank you for getting together with all of those other groups. I think that needs to be happening on a regular basis as we go forward. I used the term slow motion train wreck a couple weeks ago, and I haven't changed. I think that's exactly what we're seeing. It's getting worse over time. Whether we leave these bars open from till midnight or 2 a.m. to me is of no significance compared to the large problem that we are facing. And all of these people that are in the hospital, all of these people who are dying, they caught it from someone else. And you mentioned the Davis Street Station. About half those people were wearing masks today. So, and Councilman, people are dying because of community transmission. So, I'm fine. Let them stay open till 2 a.m. I'm very fearful that we will be having more meetings like this and that we will be forced to consider much more serious actions in the future. I'd love to be wrong about that, but there's no data right now that says we're going to get out of this. In fact, the data is saying we got much bigger problems coming down the road.
Councilman Pacheco?
Thanks, Mayor. Just a couple thoughts on it. I think we're in a rock and a hard place. We are not doing what we need to do to slow the spread. And granted, and I think the mayor is correct, a lot of the people that are dying are people that do have coexisting pre-existing conditions, which I get, and I understand that part of it. And there are vulnerable people that are dying because of it. And I literally sit my kids down almost every night to sit and say, wash your hands, wear a mask, do these things, because you may not get sick, I may not get sick super bad, but you're gonna be able to transmit that to your grandparents. My dad's 83, my mom's 78. They're at risk. They have pre-existing conditions. We are in a really rock and a hard place. And until we come to that realization that we're going to be able to do that as a community, I'm not even talking about Wyoming. I'm talking about our community, this city and this county, and how we take this seriously and how we try to do that. Off the soapbox, onto this, is rescinding this resolution is neither here nor there, because we're at where we're at. And it is what it is, and there's nothing that we can do. I am going to vote for rescinding this resolution only because it's a protest vote in the sense that we should not be gathering in big places with a lot of people. CDC, the health department, people are telling us not to gather in big places unless you can social distance and wear a mask. We are not doing it. And we have got to learn at some point how we're going to have to deal with this situation. And until we stop doing those things, we have to figure that out. So for me, I'll be voting to rescind it. And I know I probably not, obviously the vote won't count, obviously, because I think it's going to pass. But my point is that it's an idea that we need to start working as a community and start doing that. I don't know how we do it. I don't know how we get people to sit and say, how do we help one another? I don't know. I don't get it because it's very frustrating to me.
Councilman Cathy, I'll come back to you.
Thank you, Mr. Mayor. I guess my concern is, we talk about if we shut down here, everybody goes to the outliers. By the same token, if we stay open till 4, all of the outliers come here. So either way, you are actually moving people that could have been exposed to other areas. And rather than either leaving it the way it is or going to midnight, I think we ought to go back to the original 2 o'clock, which is what the rest of the county is, so you don't have the cross-contamination between the outliers and the locals. Plus, for those of us that were on council back when the smoking ban came about, we saw also at that time that this movement of the people is very real, because when Casper banned smoking, through the liquor sales dropped within the city limits of Casper and moved to the outliers. So the part about moving back and forth is very real, and I think setting our 2 o'clock stabilizes us with the rest of the community to stop some of that movement. Thank you, Mr. Mayor.
Councilman Hopkins?
Thank you, Mr. Mayor. I appreciate your numbers that you had from the various living places, group living places around town. There is one organization that has not had a case. It's assisted living and independent living. And I happen to be pretty close to the organization since I have a relative who is there. And they are treating this very, very seriously since the day it struck. And it's, right now, they do not have a case, nor do they have any employees that are off. And when you go in there, you are expected to mask up. There is probably a bottle of alcohol or hand cleaning stuff, almost every little nook and cranny in the place. And they will walk up to you and say, you have to put a mask on or get out. And I see people doing that in the grocery store, just walking in, the big sign is right there, put a mask on. I will vote to rescind what we did. We made a mistake, and especially in light of what the numbers look like today. If you look at the doubling rate, it's out of control. And I just finished reading a book that a friend of mine gave me by a guy by O.S. Guinness. And it talks about freedoms. And we get a lot of people talking about the freedom to wear a mask and not to wear a mask, whatever. Well, true freedom, this is a quote out of that book. True freedom is not the freedom to do as you like. Freedom is your responsibility to do what's right. So, thank you.
Mr. Mayor?
Councilman Huber?
Yes, I'd like to echo what Councilman Hopkins just said about true freedom. I have to say that it's very disappointing to me that we end up sitting here presuming that people are going to, in essence, do what's wrong. That they're going to, well, we're going to go out and we're going to party and we're going to have a good time anyway. Doesn't matter, if we're putting people or ourselves at risk. I think that I had a very great deal of trepidation and reservation when we passed this in the first place. I thought that it was sending the wrong message at the wrong time. I think that, this infection is just roaring through our community. And, months ago, most people could say, no, I didn't know anybody that was sick or had gotten infected. That has totally changed. This infection is roaring through our community, and I think that what we need to do is we need to send the right message. And if other communities choose to ignore the facts and ignore what's going on, put people at risk, that's up to them. That's up to those communities. That's up, they can make whatever decisions they want to. But I think that we need to send the right message, and the right message right now is, folks, this is a really, really serious thing. We are going to end up with a lot of people sick and dying from this, and we need to take it seriously. And I absolutely abhor anyone that says, well, these people in nursing homes, they were just old and going to die anyway. That is just, I really think that that is just abhorrent, and I hope that people are beyond thinking that way. I did receive one email from, I received a few where people said, the citizens have suffered enough. Let us go out and enjoy something. Well, a lot of people have suffered. A lot of people have died. There are going to be a lot of empty chairs at the Thanksgiving and Christmas dinner this year that wouldn't have been empty but for the coronavirus. Those people and those families, they are the ones that have suffered. The rest of us have had to deal with some inconveniences and perhaps some business setbacks. But, we need to send a message that everybody needs to take this seriously. I think, as Councilman Hopkins said, we made a mistake when we passed this the other day. We need to back up now and send the right message.
Any further discussion? Any amendments? Councilman Kathy.
Thank you, Mr. Mayor. I would like to amend this ordinance to go back to the original 2 o'clock closing for the bars.
So there's an amendment on the table to rescind the resolution that was put in place and go back to the original 2 o'clock closing. Do I have a second?
I'll second.
Second by Councilman Powell. Any discussion on that? All in favor of that, say aye.
Aye.
Aye. All opposed?
No?
Or aye, yeah. Oh, that works. Nay, aye.
Looks like you need to count them, Mr. Mayor.
Yeah, please record the vote.
I believe I caught that Councilman Johnson, Hopkins, Lutz, and Huber voted nay,
Oh, and
and Pacheco and Bates. My apologies. So motion to amend failed.
Okay. Any other amendments? Okay. Then on the original rescinding of the resolution, all in favor say aye.
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 What would be,
I think we only have a few nays, so.
Just a sec. Sorry, just to be clear. What we're voting on is rescinding the resolution. So if you say aye, then you're wanting it to go to midnight?
Yes.
Okay. Okay.
Run that by again. If we say aye, we're moving to close at midnight. Yes.
Correct.
Okay.
Maybe go one by one.
All right.
I'll just call each.
Yeah, let's just call them out.
Councilman Bates. Vice Mayor Lutz.
Nay. Oh, sorry. Nay.
Councilman Pacheco.
aye.
Mayor Friel.
Aye. Aye. Yeah.
Councilman Powell. Aye. Councilman Hopkins.
Aye.
Councilman Johnson.
Nay.
Councilman Kathy.
Nay.
With council members Powell, Hopkins.
Huber.
Oh, yeah, I didn't get to vote.
Councilman Huber.
Aye.
Thank you. With council members Powell, Hopkins, Pacheco, and Huber voting aye.
Should be
Does
five.
that make it fail, City
There
Attorney?
should be five, isn't there?
No, you had me in there also.
Sorry. With Mayor Friel also, that puts 5 to 4. Is that correct? City Attorney?
I believe that you would be correct. The motion stated by the mayor was to rescind the resolution 2020-206, which, and to actually then have the local liquor establishments stop operating at midnight, which was the resolution. So whereas the resolution before the council that was moved and seconded, that's the essence of it. But typically, if you're going to move for the resolution, you would be saying, I move forward as opposed to rescinding. So I believe that what you voted to do is to repeal the resolution, extending the hours, and to move it back to midnight to close tonight. But maybe, just because it is that a bit of confusion, if we could maybe have it restated, Mayor, those who want to vote in favor of the resolution that was moved by, I believe, Councilman Huber and Councilman Hopkins, or Councilman Hopkins and seconded by Councilman Huber, which would be the one on the table. We're probably looking for an aye vote. which would be in favor of the resolution that was handed out for this special meeting, or for this emergency meeting.
Okay, so those in favor of moving forward on the resolution? All those, and I guess you want to go back through it again?
Stick up your hand and.
Yeah, so it's the same.
So those in favor of it, say aye, or raise your hand for aye.
So I caught, okay,
Pacheco.
Yeah.
three.
Rio, Pacheco, Hopkins, Powell, Huber.
And Huber.
So those I show in favor would be Pacheco, Friel, Powell, and Huber. The rest being nay.
And Hopkins.
Hopkins. Bob Hopkins, too.
There's 5 yeas and 4 nays.
That's what I got.
City Attorney, is that enough to pass?
That is.
Okay. Motion passed.
Okay, the chair would entertain a motion to adjourn.
So moved.
Moved by Councilman Cathey, second by Vice Mayor Lutz. Any abstention or nay votes? All voting aye? Aye. Please record
Aye.
the vote. Please.
All voting aye, motion passed.
And thank you all for letting me appear by telephone
Yep. Thank you all for showing up tonight.
today.